From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. When was the last time you thought about your dental hygiene routine? It's probably been a while. Brushing and flossing twice a day seems straightforward, but there's a lot more to keeping your mouth healthy than just those basics. A solid at-home routine is super important, not just for your smile, but for your overall health. Today, we're joined by Whitney DiFoggio, a registered dental hygienist, founder of teethtalkgirl.com, and dental health educator. She's built an amazing community across her channels at Teeth Talk Girl, educating both dental professionals and everyday people, making oral health easy to understand. In this episode, we'll dive into the essentials of at-home dental care, cover common mistakes, and get expert tips to keep our smiles looking and feeling their best between dental visits. So grab your toothbrush and let's get started. Hi, everyone, and welcome to the Care Experts podcast. I'm your host, Erin Treloar, and I'm so thrilled to be sitting here today with dental hygienist Whitney DiFoggio. Whitney, I feel like everybody right now is talking about our sleep routine or our bedtime routine or our evening routine. And a critical component of that is our dental hygiene routine. So can you just start us off by talking a little bit about why it is so important to brush and floss and really work on this routine?
So I love it because, yes, everyone's spending a lot of time on their skincare, on all these things, and dental care is so important. A lot of people think your teeth are just for smiling, and it's like cosmetic and to look pretty and nice, but teeth, it's more medical, right? Your mouth is the gateway to your entire body. That's what I like to tell my patients. Anything you put in your mouth, it's not only affecting your whole body, but it's affecting your dental health. And your dental health directly relates to your overall health. Long story short, it's a lot more important than people think. It's not just for cosmetics, it's for your health.
Okay, so let's talk about how to really get a healthy mouth, healthy teeth. What are the key components of a healthy dental hygiene routine?
Yes. So I always say you don't have to do a million things. It's really two things. You need to brush and you need to floss. There's all these different, of course, once you get that down, we can talk about additional things you can do. But brushing, flossing, of course, visiting your dental office routinely as well. But at home, since we're talking about at home, the brushing and the flossing, there's so many different statistics out there. You know, it depends on what polls you look at, but most of them lead to about 40% of Americans only brush once a day. And so we should be brushing twice a day. That's a huge number of people not doing the basic bare minimum. So I always just tell everyone, like, let's start there. We need to make sure we're brushing. We need to make sure we're flossing and or cleaning between your teeth with something. If traditional string floss isn't working for you, we can try floss picks. We can try interdental brushes. There's all these different tools you can use to clean between your teeth. But you need to clean the fronts, the backs, the sides, the tops, the bottoms, everything.
We can't skip it.
That's
the
really
basic basics are brushing and flossing twice a day.
You want to brush twice a day. You really only need to floss and or clean between your teeth at least once.
Okay.
I do say, optimally is before bed. That's like the best time to do it is before bed. But a lot of people are tired at night. And if flossing in the morning works better for you, that's fine. You just want to disrupt that plaque sitting on your teeth. It's like a biofilm layer of plaque and debris. You just want to disrupt that at least once every 24 hours in between your teeth. So try to stick to the same time every day if you're doing the brushing, the flossing once a day. So.
Okay, amazing. Are there any common misconceptions that people have about dental hygiene?
Oh, so many. I don't even know where to start. The reason I'm pursuing graduate studies is to just figure out how to combat all the misconceptions. But I would say just like simple ones that don't get too controversial is definitely that you don't need to brush your teeth. Like a lot of people, especially on social media, are like, well, I don't eat sugar, so I don't need to brush. And it like doesn't work like that, right? There's always plaque forming on your teeth. Inevitably, no matter what you do, no matter what you eat, there's bacteria in your mouth. Everyone's bacteria levels are different, but yeah, that's a big misconception. Everyone needs to brush and floss. There's no way out of it. That like oil pulling, not to bring up so many random things, but a lot of people are saying oil pulling can replace brushing and flossing. It's not replacing anything. You need that mechanical removal of plaque with your toothbrush and your floss and or whatever interdental aid you use.
Okay, amazing. I want to dive even further into some of these myths. But before we go there, let's go back to the basics, just making sure that everyone really has these down. So we are brushing twice a day, flossing at least once a day. And when you're brushing, how long do you want to brush for?
It's 2 minutes. You should be brushing for a full 2 minutes. Lots of the electric toothbrushes now have built-in timers. So the toothbrush will either turn off or beep or somehow alert you that you did your 2 minutes with the electrics. But if you're using a manual toothbrush, you would be surprised how long 2 minutes feel. You know what I mean? A lot of people don't realize, I'm sure I brushed 2 minutes, but put a timer on. There are great apps out there like Better Mouth. There's a bunch of apps that have toothbrushing timers within them, or just use the clock on your phone and do the full 2 minutes. You should do 30 seconds in each quadrant. So it's 30 on the upper right, 30 on the lower right, 30 seconds everywhere. And then you're good.
Amazing. I was going to ask you, do you like to have a specific routine of where you go in the mouth and where you follow?
So, I'm all over the place nowadays with my own mouth. However, I do recommend patients stick to a routine until you're in it, right? Until you know your routine. When I'm scaling teeth as a dental hygienist, I have a definite order because
there's a pattern.
Yes, if I get to chit-chatting, I don't want to forget where I'm at with the patient. But in my own mouth, dental hygiene is my whole life. So, but I would stick to a routine at the beginning, at least do all the tops first and all the bottoms, the minute on the top and the minute on the bottom, something like that. So you don't spend too much time in one spot. There are some patients that, why is this one area of your mouth so clean and nothing else is? And then they'll be like, that's where I start. I must be really good when I start. So on that same note, maybe opposite, sometimes you might want to start somewhere different. So you're not always starting in the same spot, because that might be the spot you clean the best.
Yes. I feel like this is so important because a lot of us probably end up on autopilot with brushing our teeth. I'm thinking about this time when I was applying tanner on my body.
Yes.
And somehow got distracted on autopilot, probably kids running in and out of the room. And I literally did I did one leg. And so I can imagine if we're on autopilot with our brushing, we might be, doing a better job on one side of the mouth or top versus bottom. So coming back to having that structure, setting the timer for 2 minutes, doing the left side top, right side top, and go I think this is a really amazing reminder for people.
I love it. And if you think you're doing fine, always ask your dental hygienist, am I doing fine? Because you never know. It's hard to look in your own mouth. It's dark in there. You can't really see if you're doing a good job. So
okay, on that note, do you think people should be looking in the mirror when they're brushing their teeth? I know some people like to brush in the shower. Thoughts on this?
Yes. So, no, I prefer you to look in a mirror because you want to make sure you're getting those angles right. Again, whether you're using an electric toothbrush or a regular toothbrush, you still need to get the angles right. I like electric toothbrushes because they do the work for you. There's less chance of user error. However, you still have to angle it toward your gum. I always say 45 degrees toward the gums. So once you get that electric toothbrush where it needs to go, you just guide it along from tooth to tooth. But it helps if you're looking at yourself in the mirror because you're not sure, am I missing the gum line? Everyone misses the gum line, right where your gums meet the tooth. And you can't feel it unless you're seeing. So it really does help to look in the mirror.
Do you think, I'm a mom and have 2 kids, do you think that parents should be brushing their kids' teeth, or at what point did they start learning these techniques themselves and brushing their own teeth?
So the manual dexterity usually doesn't happen until age 8 to even 10.
Yes.
And that's late. And a lot of people, once their kid is 4 and they're kind of doing it themselves, they stop because they're like, oh, my kid knows how to brush.
Right.
But if I know the American Academy of Pediatric Dentistry, a lot of the associations do recommend to let your child brush themselves because that's great to have the independence, but always go back in after and brush and do a good sweep through for them after. Up until age 8, you know your child best if they're doing a good job, how their dexterity is, but they really, more likely than not, don't have what they need in their hand motions to be able to do a good job.
I think my kids still need help.
Love
them, but if we're doing it properly, they could probably use a hand.
Some adults still need help because again, we're just sloppy, we're quick, we're going fast, but it's really just 2 minutes, 4 minutes of your day, 2 in the morning, 2 at night, but just give yourself that time. And again, your oral health directly relates to your overall health. It's not just making your teeth look good. It's really helping stimulate your gum tissue, remove plaque, reduce inflammation. Brushing your teeth is not just like an annoying. I know it seems like a chore, but it should be an act of self-care.
I found such a change when I brought mindfulness to my brushing routine, where I would just take a couple of really deep breaths as I was brushing. I would actually focus on the process rather than thinking about what I'm doing the next day or, what happened during the day. It's like really a beautiful way of habit stacking some stress relieving mindfulness into your brushing routine, flossing routine.
I love that you do that. That is so great. And a lot of people have a hard time doing that. So that's so great that you're doing it. And that's when I always recommend those apps again. The apps can track and they can tell you like, move on to the next quadrant, move on to the next area, or they can give you dental facts. If you can't get into that mindfulness, they can tell you like, right now you're reducing inflammation. So I'm all for an app like Better Mouth.
Amazing. Yeah. Do you have a favorite app?
I do. Better Mouth. I'm the oral health advisor for them. So I know all the information on there is great. But there's a lot of great apps. You can get apps too for certain toothbrushes, have them connected to the electric toothbrush, you know, something to just motivate you, because a lot of people have a hard time just doing it in general and then doing it and being mindful.
Yes. Okay, let's talk about the tools that we use for this. You just mentioned electric toothbrushes. Do you have a preference over regular toothbrush versus electric?
Yeah. So again, according to the American Dental Association, both are effective if used correctly. And that's a big if. And it's easier to use an electric toothbrush correctly. The manual toothbrush, again, you just have to really make sure you're using it not wrong. So with the manual, there's so many different brushing techniques out there, but usually the very universal one is little circles, gentle circles. You don't ever want to scrub brush like you're cleaning a floor, your kitchen counter. You don't want to be scrubbing. You can hurt your gums. You always want to be using a soft bristled toothbrush. Most of the electric toothbrushes are soft, most of them. But when you're getting into the regular manual one, when you're picking, whichever one you're picking, just make sure it's soft.
Do you have a favorite brand when it comes to electric toothbrushes?
It's hard to say. I would say no, just because there's circular ones. Maybe you've seen them. There's circular ones, and then there's regular toothbrush heads that look like a toothbrush. The regular ones generally vibrate, and then the circular ones oscillate or spin. Sometimes they do a little bit of both. Either way, it's really patient preference. I love the electric toothbrush that the patient is going to use. If you like the toothbrush you're using, you're more likely to let it go for the full 2 minutes. If you're using a toothbrush you hate, if it bothers you, if it vibrates, if it tickles you, if you don't like it, if it doesn't have what you need, you're not going to use it. So I think that's what's great about a lot of these brands. They make a lot of different types so you can find what works for you. Amazing. There's not a one size fits all.
And when it comes to flossing, any favorite flosses or techniques that we should know about?
Yes. Oh, so technique right away. But when we're saying flosses, again, there's waxed, there's unwaxed, depending on what brand you have, depending on what flavor there is, all that stuff. It's really what works for you. Again, I know that's like an answer nobody ever wants to hear, but at least with floss, it's easier to do a trial and error because floss isn't that expensive. You can go buy a floss, and if it didn't work for you, try another one next time. But I know an electric toothbrush is an investment, and it's sometimes hard to figure out which one you are gonna like. So always ask your dental hygienist. They can maybe guide you in a decision. But back to the floss, I would say I prefer for my teeth. It doesn't matter what I prefer for my teeth, but if it's fraying, some people floss and then it frays. That will, try the waxed versus unwaxed. Try the one that doesn't fray. So it's just a lot of trial and error. But I will say, back to technique with floss, in movies and TV shows, they always show people going like that.
Right. Going back and forth with their floss.
That's wrong.
No seesawing.
No, they need an expert hygienist in these shows. I always say they have expert. I'm like, why is nobody? They're always going like that. That's not what you do. That might be how you get it in.
Right.
But when you want to go up and down, think about it as cleaning the side of the tooth.
Of course.
Yeah, hugging the tooth up and down. Right. When I have my patients show me in the chair, I'm like, hey, show me how you're flossing, because I'm just curious. They're saying they floss every day, and they show me like that, and I'm like, that's not doing anything.
Right. We're only hitting a little bit of the surface area of the inner tooth.
So it should go all the way up there. It should disappear under your gums a little. The string, it actually will disappear a little. If you're hugging it around the tooth, it's not going to hurt. Okay. Sometimes people pop it up there, and that's going to hurt. So you want to wrap it around each tooth, up and down the right, up and down to the left. But
okay, amazing. Is it normal for your gums to bleed when you floss?
No. So here's the thing. A lot of people say my gums bleed because I floss. It's like, no, your gums are bleeding because you don't floss.
Okay.
So
Tell us more.
I never want to like joke about it, but it's just, that's a joke on social media. Everyone's
Yeah.
always saying that in the dental community, but no, it's true. It's, if your gums are bleeding when you floss, it means you're either not flossing properly,
Okay.
or you're flossing properly, but are you doing it every single day? You know, maybe you're skipping days, which increases inflammation of your gums. And now when you touch them, they're going to bleed. Or 3, you haven't had a professional cleaning in a while and there's tartar or calculus below the gum line. And when you're flossing, that bacteria essentially is like annoyed and it starts bleeding. That's how I say it to the kids. It's easy. But yeah, so it's one of those 3 reasons usually. So although bleeding when flossing is unfortunately common, people think it's normal, but if you were to touch your skin and it bled, that you'd be like, wait, why?
Yes.
So it's the same with your gums. They should not bleed.
What are your thoughts on mouthwash? Is that something that we should be using consistently every once in a while? I'd love to hear what you have to say about it.
So with mouthwash, there's a lot of misconceptions out there too. A lot of people are saying like, never use mouthwash with alcohol. It'll dry out your mouth. There's some research that suggests that for people who already have dry mouth. So if you already have dry mouth, you might not want to put any alcohol in your mouth because it can potentially dry your mouth out. But for the general public, alcohol versus non-alcohol, it doesn't matter. It's really what you like. But I will preface this all with saying you don't need mouthwash unless you do. And I know that's weird, but there's 2 types. There's anti-cavity and there's antiseptics.
Okay.
Broad. I know there's a million others, but those are the broad 2 types. And an anti-cavity mouth rinse can be great if you're someone who's cavity prone and you're doing everything you can. You're brushing, you're flossing, you're doing all of the things. Maybe it's an additional thing you need to use before you go to sleep. You can brush, floss, switch with that anti-cavity mouthwash, spit, and then go to sleep. Allow the ingredients to do what they need to do when you sleep. I think anyone can benefit from an anti-cavity mouthwash, but you don't need it. Okay. For the antiseptics, those are usually just fresh breath. They're really... Some people might be almost prescribed or recommended them by their dentist if they're undergoing gum treatments or different gum situations to help reduce bacteria and stuff. But overall, those antiseptics, if you want to use it in the morning to have fresh breath, it's fine. But always talk with your dental professional to confirm which one's best for you.
Okay, you just mentioned something, which was supporting our gums. When we're talking about our dental hygiene routine, what are the main benefits? Like supporting the gums, preventing cavities? Is there anything that I'm missing?
Those 2 are great. Oral cancer risk, that's a huge one too. Okay. You know, I will say though, when I went to dental hygiene school, I really thought it was all about cavities because it's all you're ever told, like at least as a kid, no cavities, you're good, you know.
Rinse the sugar bugs away.
Exactly. You know? And cavities are very important. But I think something that doesn't get discussed enough is the importance of your gums. And more research and more studies are showing your gums, poor gum health can directly relate to poor heart health or, you know, all these different studies that aren't fully showing a causation yet, but there's a lot of associations. Yes. So if keeping your gums healthy can keep your overall body healthy, I would say that's the main one for my priority. Cavities, of course, if you have a cavity, you drill it out and you fill it, right? Or you get a crown, or you get, you know. But when you have gum disease, it's usually not localized. It's usually generalized. It's all your gums, all your teeth. It affects the whole mouth. And of course, localized is possible, but you don't want to lose all your teeth because that's what happens with gum disease. Your gums, they get infected. There's bacteria. Those little bad bacteria, they eat away at your bone, and your bone holds your teeth in. So yes, we want teeth to be able to get cavities on. You don't want you to lose your teeth. So
absolutely. Okay, that's very motivating for all of us to be brushing and flossing. What are your thoughts on tongue scraping?
Oh yeah, I love it. Again, like, it's great. Again, I always say you just need to brush and floss. But if you want to add other things, that's great. I use a tongue scraper. I think it's really satisfying. Some things show that it's like 90% of the bad breath bacteria are found on your tongue. Okay. Whether that's like 100, you know.
The jury's a little bit out. We're not sure about the firm research on that.
Yes, we don't know the exact percentage, but a lot of bacteria is on your tongue. And you know that. If you ever do the lick test and you smell it, you're like, there's something on there.
Yes.
So of course, tongue scraping, or at least just brushing your tongue with your toothbrush. That works. I have some patients that use the spoon from their kitchen, the spoon they would eat cereal with. They just use that. They keep that in their bathroom.
Yes.
That works. Just something to remove that extra gunk from your tongue.
Amazing. As we know, the mouth is the first step in our digestive system. Our teeth break down food. Our saliva has important enzymes that help start facilitating the digestive process. What do we need to know about our diet and our dental hygiene?
I love that. A lot of people forget that your mouth is part of the digestive system. Yes. They don't think of it. So it is a great point to bring up. Everyone thinks sugar's bad. Sugar causes cavities. That's true. Yeah. However, what a lot of people don't realize is it's not just candy. It's not just cake and all the things we think of in desserts. It's also bread. It's carbohydrates. They break down into sugars while they're being chewed in your mouth, especially fermentable carbohydrates, crackers, goldfish, cereal, all this stuff we don't think of. Those are even worse for your teeth, arguably, than candy, than a chocolate bar. Because the chocolate bar, think about it, you could kind of rinse that away with your saliva, but think about cereal or like the goldfish, like they get up in there. And that's where cavities form. They love the bacteria in your mouth, love to eat that stuff. And then the acids they secrete, acids are what creates cavities in your mouth. So I think my thing is, don't just think you're doing great because you don't eat sugar per se, you don't eat candy. Just anything else can cause cavities. And then other people be like, I don't eat carbs either. And it's like the bacteria in your mouth, they have to eat something. Right. So even if you're just eating like healthy vegetables, healthy meat, and then of course the way these things are prepared, are they breaded? There's always going to be something for that bacteria to eat in your mouth. So don't think just because you don't eat sugar, you're in the clear.
Are there any things that we can do proactively to support our teeth if we're having more acidic foods or if we're having sugar, carbohydrates?
Yes. So actually, the order in which you eat food really does matter. So I always say, if you're eating cheese and crackers, cheese is actually very good for your mouth because it's neutralizing. It's like a pH neutral. And like we said, acidic levels in your mouth can cause cavities. So if you're eating cheese and crackers, make sure you eat that cheese as the last thing. That can help, eat the healthy foods last, which nobody wants to do. I mean, eating your dessert first, honestly, is better for your teeth. But
permission to have dessert first. Right. You heard it here.
Right. I know, that's what I live by. And then also swishing with water. It does so much good. Even after your morning coffee, if you drink your coffee or your tea and you swish with water after, don't let that coffee be the last thing on your teeth for hours and hours. That just gives that bacteria. You want to swish away as much as you can. A really good swish. You could drink it, you could spit it out, whatever you need with your water. Sipping on pH neutral drinks like water can help so much.
Amazing. I know you said that it's important to be brushing twice a day. Yeah. Do you personally brush after you have lunch or a coffee?
Depends on how much time I have.
Yeah.
So I would love to. I mean, of course, at work, we have built-in time for our brushing session after lunch.
Do you?
So we all do brush at work. But we are a dental office, but not every work. You might need to get to a meeting. So we do like to brush. But, technically, I don't want anyone to overbrush because, everyone's different. But you know yourself best. If you're someone who's nervous and like, okay, I'm going to brush 7 times today. Don't worry about it. Like we're all human. It's fine. Do the best you can. If you want to do 3 times, if you want to do 4 times, if you have the time, sure. But also overbrushing is a thing. Technically, you want to wait 30 minutes before you brush after eating. Okay. Just because your teeth, your mouth is a little acidic after eating. Usually what we eat, most of the things are a little acidic. And if you brush too soon and you're doing it a lot, it could probably, your enamel's a little more weak. You don't want to be like scrubbing at it. Yeah. Having said that, there's other things you can do. You can swish with water and then brush if you really want to. Just try to get your mouth a little pH neutral. So overall, don't overbrush, but if you really want to, that's fine too.
Yeah. Like anything, we don't want to be adding more stress to your day, and we really want to keep things as simple as possible. Right. So our primary focus here, Whitney is telling us, brush twice a day, morning and night, floss once a day. And let's all start working on that, committing to that this week. Ideally using an electric toothbrush, but also, whatever works for you. All right, I want to talk more about common dental hygiene myths.
Oh, yeah.
I've got some written down here. I did a little research on kind of common things that are popping up for people.
Okay.
First, before I ask my questions, though, are there any glaring myths that you're seeing on social media right now circulating that you want to bust?
Sure. I will say the fluoride controversy. It's always scary to bring up because people have their opinions on fluoride, but whenever people are talking about toxicity or throwing the words toxic out there without any context or dosage, that's misinformation, right? We all know anything could be toxic at a certain dose. Even the oxygen in the air we breathe, even spinach, if you eat too much spinach, so anything could be toxic. So, and again, if you don't want to use fluoride, that's fine, but don't spread misinformation that it's toxic because it's not. Anything can be toxic at a high enough dose. Fluoride toothpaste.
Okay,
right?
so fluoride toothpaste is totally fine, safe, and we don't need to be worried about it.
100%.
Is it important to have fluoride in your?
It's very important. So that's why I'm so passionate about it, because I've seen patients that remove fluoride. This doesn't mean it's going to happen to everyone, but some people who are cavity prone, and they may have not known they were cavity prone until they removed fluoride from their regimen, and then they come back and now we have 12 cavities, and
you're like,
I'm
what are you doing?
Yeah, what did you do different? I just changed my toothpaste to something more natural. Even though fluoride is natural, it's found in the earth, it's in the soil. So long story short, that one gets me just because I see how it influences patient behavior and it damages their dental health.
That's why the work that you're doing is so important, to make sure that real, true, factual, research-based information is out there.
I'm trying.
All right. Okay. So you don't need to brush your teeth if you drink enough water.
Ooh. That one, no, that's a myth. I just haven't heard that one too much on. No, water's great, but again, nothing is going to replace that manual removal of plaque with your toothbrush and floss. Just swishing, it can help reduce what's going on in there, but it won't prevent it.
Okay. Is it true baking soda can whiten your teeth?
I mean, yeah, it could. Well, no. You know what? Yes and no. Baking soda, it's kind of like the toothpastes, the whitening toothpastes. That's the main ingredient. It's a little bit abrasive. It can help maybe remove stains. That's why I said yes and no. It can maybe remove stains and make your teeth appear whiter, baking soda. But it's not going to make your teeth shades whiter. It's not going internally and whitening them from the inside out. It's just if you have a little stain or you're stain prone, you drink a lot of these stain causing drinks, sure, it might help, but it's not going to whiten them.
Okay. Do charcoal and all natural toothpastes actually work?
Oh, that's a two-parter. Okay, so I'll start with charcoal. Charcoal, unfortunately, I don't recommend it. Charcoal toothpaste, very bad, but it does kind of work until it doesn't. So the thing about charcoal is it's very abrasive. So you have enamel. Enamel is the outermost layer of your tooth, and then there's dentin, which is underneath. Enamel is white, and dentin is yellow. When you're using charcoal toothpaste or very abrasive things like that on your teeth, you are etching away layers of enamel. So I just etched away this layer. Whoa, the layer underneath is so white. I etched away another layer. I etched away another layer. You keep etching away these layers with charcoal until you reach the dentin. And the dentin, that's yellow. So you brushed your teeth yellow. I mean, that's horrible. You're going to be very sensitive. You will know when it gets to that point. But enamel doesn't grow back. So once you brush it away, it's bad.
Have you seen that happen?
In some areas, perhaps. Where we get close, I have not seen the dentin. You'll know before the dentin comes through. But yeah, I've seen people brush away at their enamel. It's a bummer. Or they're using those hard bristled toothbrush or firm on top of the charcoal or whatever DIY mixture they use at home. And I don't. So there's the first. And then the natural toothpaste, again, a lot of toothpaste that advertise themselves as natural. There's a lot. I could talk for 90 minutes. I have a whole presentation on this in the dental world, 90 minutes about this. But so to recap it very fast is anything that doesn't have fluoride in the U.S. for toothpaste or dental products is not regulated. So oftentimes these natural products fall under that category. They're not regulated. So oftentimes, no, they don't work because nobody's regulating that they do. Not to say some don't work. Right? There's nanohydroxyapatite. That is a great promising alternative ingredient to fluoride. However, it has to be, there's a lot of stipulations. It has to be 10% nanohydroxyapatite. It has to be rod shapes versus cone shapes. It has to be nano-sized particles, not micro. And since there's no regulatory processes right now to confirm what the company claims is on their toothpaste label, you don't know if you're getting the good stuff. So I would say be careful with natural because, again, no regulatory processes. If you want a natural toothpaste that has fluoride in it, that exists too, where maybe it's SLS free, sodium lauryl sulfate free, or all these different, no dyes, go for it. As long as it has fluoride. But
having the fluoride is important. Okay.
For cavity prevention,
So good to know. And our last myth, does oil pulling actually have any proven benefits for oral health?
So yeah, there's limited research, but I'm pretty open to. I love when things have some research to them. It can help. Of course, the biggest one I've seen is that it can help with dry mouth, and I'm like, well, that makes sense. It's like oil all up in your mouth,
Yes,
helping with your dry mouth.
Yeah.
There's all these other things that have been claimed. Hey, if you like doing it, it's fine, but it, again, doesn't replace brushing and flossing. And then always know the risks with it. Be careful. A lot of the research is done regarding 20 minutes of swishing.
Yes.
And that's a long time.
It's a really long time.
And there's been data to show, or even in the news to show, like, if you breathe in on accident, you could give yourself like a pneumonia situation. So don't be breathing in when you're swishing for that long. That could be a risk. I'm trying to think of other risks. I come from a family of plumbers, and so don't spit that down your sink.
No.
It will ruin your plumbing.
Yes.
That's like not a dental fact, but it's just a fact.
An important fact for people
if you're
to
gonna do
know.
it, spit it into your trash can.
Yeah.
Do not spit it in your sink and your pipes. That'll be bad. But yeah, there's always risks with things. But when they're not as evidence-based, when they're limited research, I'm all for it. But I want to make sure we know like what can go wrong.
Okay, amazing. We always have Ask Me Anything questions from our audience and listeners, and they have some amazing questions for you.
Okay.
Let's dive in. Is sparkling water okay for your teeth if it's sugar-free?
Ooh, okay. Yes, it's fine. I'd rather you drink sparkling water than sip on soda or juice all day.
Okay.
Having said that, sparkling water sometimes has a higher, more acidic level than still water. Not always, but sometimes. So just if you're able to check the pH of it,
Yes.
that would make me feel better. But again, if you love it and your dentist and dental hygienist hasn't noticed anything going on with your teeth, I'm okay with it.
Carry on. All right. Why do my teeth look yellow despite having good hygiene?
So yellow teeth doesn't equal unhealthy teeth, and white teeth doesn't equal healthy teeth, right? Just the shade of your tooth is an anatomical oftentimes, or it can have to do with your diet as well. But a lot of times people just have more thin enamel than others, right? If your enamel's thin, like we were talking about earlier, the dentin layer, which is yellow, might just be peeping through a little more, poking through. Whereas if you have very thick enamel, you might be able to drink all the coffee in the world and you never get stained because it brushes right off and your dentin layer. So don't worry about it. It's a lot of genetics. Or if you're a smoker, things like that, it can be lifestyle as well.
Okay, amazing. I have a permanent bottom retainer and it gets some plaque buildup. What's the best way or tool to keep that from happening?
Those are tough. I know those very well. But they're great because they keep your teeth in place after you had braces or whatever you had. So you need I would say that's where I'm really passionate about an electric toothbrush.
Okay.
Get in there, hold it in there. What we were saying earlier, 30 seconds, 30 seconds, 30 seconds, 30 seconds for your mouth. Do an extra 30 seconds just on that area.
Okay.
Just like really gentle, just get in there. On top of that, of course, cleaning between.
Yes.
There's these little floss threaders you can buy. It's like a hard piece of floss that you put the floss. I'm going to make it sound like it's so complicated, but it's not complicated. Super floss is another one where it's a hard piece of floss so you can stick it through really easily.
Yes.
And then you could floss like normal. There's also the proxy brushes. That's a great option. Just find what works for you, right? Proxy brushes they look like those little Christmas trees, little bottle brushes. Maybe you've seen those.
Yeah.
A lot of people use them with braces to clean their brackets, but there's different sizes. You can actually use this in between your teeth. Those people love because it's so easy. You just go like, just on those lower six. And then of course, water flossers too. Would I love for you to use like everything? Yes, but no, you don't have to use it. Just try which one works for you and see if it works.
Amazing. And our last question, is it actually possible to get rid of bad breath for good with good oral hygiene? Or is it something you have to keep managing?
Ooh, a little bit of both. So it depends on what is the cause of your bad breath.
Yeah.
Oftentimes it's your tongue, like we were talking about. Brush that tongue, scrape that tongue. Maybe that's what the issue is. If it doesn't go away after the tongue, let's figure out what you're doing with the flossing. Because the next idea is there's bacteria under your gums that's causing that. Those are like the main things. If after you've seen your dentist and your dental hygienist, you've got all the cleanings you need, you're maintaining, and you're still having bad breath, then it's probably systemic. Or maybe you have tonsil stones in the back of your throat. Maybe you have allergies or postnasal drip or GI issues, gut problems. It's probably coming from the back of your throat. If you already went to your dentist and they said everything's good, then explore what might be coming from the back of your throat.
Amazing. Thank you so much. I
Thank
feel like
you.
we all learned a ton in this episode, and I know I'm personally feeling very motivated to just check back in with my routine and to really come back to those basics and maybe layer on a few other things like the water flossing or the tongue scraping, a little bit of mouthwash. So thank you so much for sharing your expertise.
Thank you for listening. I love it. I love teeth.
Through November 30th, 2025, earn an entry for a chance to win $5,000 in the CareCredit Let's Get Digital sweepstakes. Enter the secret word dental in the sweepstakes hub to earn one entry now. Head over to the sweepstakes hub by simply visiting carecredit.com/let's get digital. No purchase necessary. A purchase will not increase your chances of winning. Legal residents of the 50 United States, D.C., and U.S. territories 18 years of age or older who have a CareCredit credit card as of 9/2/2025. Void where prohibited. Promotion starts 10/8/2025 and ends 11/30/2025. Grand prize and weekly prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/let's get digital. Sponsor Synchrony Bank, 170 Election Road, Draper, Utah, 84020.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.